Welcome to a world where particles, vibrations, and light collide, a place where leading industry experts and healers come together to discuss controversial topics that will challenge your beliefs and expand your mind. From quantum physics to metaphysics, no topic is off limits, but this is not your typical podcast.
Always be in your integrity, and in your integrity you understand that it is what it is. Energy is until it's not, right? Energy is flowing into your body until it stops flowing because it becomes so clogged up, and then disease begins, right? So be in your integrity. When somebody's saying something that you totally disagree with, don't sit in your mind and go, what an idiot, right? Just say, wow, they're really convicted on how they feel. That's amazing. Bless them in their thoughts. Don't be judgmental in their thoughts. Bless them for having the power to feel the way they feel, even if it's different from you.
It's a show guaranteed to make you question your assumptions and push you to expand your horizons. For those who are already fascinated or passionate about the work of Patti Conklin, this show will give you an inside look into the mind of one of the industry's most renowned figures in vibrational mediation. With over 28 years of experience and a long list of big-name collaborations, Patti's insights and perspectives will inspire and challenge even the most seasoned practitioners. And if you're the skeptic who doesn't believe in vibrational mediation, this show is for you. Healers, doctors, and scientists are just a few of the professions represented by our fascinating visitors that bring their unique perspective to every episode. Join us on this journey into the world of healing within and adventure inside. Our mission is to inspire, challenge, and enlighten our audience with thought-provoking conversations and fascinating guests from a wide range of fields who can shed new light on important issues facing society today. Join us for each episode if you're ready to explore and learn about the latest developments at the intersection of cutting-edge science, spirituality, and self-improvement. Enter a world where waves, particles, and light all meet. Enter the world of healing within and adventure inside.
So Frenesa is a medical doctor. She's an internist and has been doing that for like 30 some odd years. And
I started when I was 8.
Yep, and I started my work when I was about 3. So yeah, we're good. But she's an awesome MD. And, you know, day work is working as a medical director in life insurance. But, you know, that's great. I mean, she was certainly having her office for many years. And we
really killed me.
Yeah, it was rough work. I mean, I remember how rough that was. But we started out as neighbors. And then, you know, we weren't so skeptical of each other. And then we moved into doing the work we do together now with clients and doing our shows and bringing advice. And I think that one of the reasons our shows work and have worked throughout our history is that we can respectfully disagree with each other. And we still, you know, lots of things we do agree on, but the things that we don't agree on, we just have differing opinions. And I think for you, the viewing audience, you get the best of two worlds. You know, Frenesa is not a diehard MD, as some are. She certainly incorporates natural methodologies before she goes into Western methodologies. And that's what I appreciate about her, is the ability to go in and look at things from a holistic standpoint. If she needs to go into Western, she does. And she just keeps her mind open. So that's critical. And that's why I think she's an awesome MD.
Thank you.
Because she's able to do that.
I appreciate that.
But let's look at, you know, we talked about what to talk about on this segment. And so, you know, we decided to talk about, you know, diagnosis cancer. Now what? And I think that we talked about taking a step back to that pre-diagnosis, being aware, pre-screening, the importance of pre-screening, and letting go of the fear of pre-screening.
Mhm.
For me personally, I want to have a baseline. I want to know what my baseline is, even though I am incredibly sensitive on energies and working with energy and having energy within my body and so forth. I still get a mammogram every year. I get a mammogram because that's important to me. I want to know that baseline. I do have a colonoscopy every other year. Now I'm really dating ourselves here. I still am older. I can't change that. But you're reaching an age now where we're doing things simultaneously in our years. You're not a youngin anymore.
No, that's
So
for sure.
let's talk about pre-screening, because people get the attitude of, I'm not going to entertain the energy of cancer. And so if I go have pre-screening, then am I not setting myself up for the idea of cancer? Am I not allowing fear to come in? And secondarily, what about all the radiation that I'm going to get from a mammogram, or, whatever kind of testing they're going to do? People get so caught up in the fears of pre-testing and not really looking at it as a screening, and that's all it is, and it doesn't have to be anything more. So talk to me about that.
Well, I think that screening is a way to double check and make sure that you are actually on that healthy path. We talked about earlier that so much of what we think and believe, and not just consciously, but our subconscious, which is, the vast majority of our mind, what our subconscious believes and is, chewing on, so to speak, influences the different issues that we have are challenged with.
Mm-hmm.
And many times, if not most of the time, most of us aren't really tuned in to what's going on underneath the surface of our conscious mind.
Right.
And we think that let's just say, I'm, for myself, okay, I'm eating a decent diet, I'm exercising, I'm taking a variety of nutrients that I think are important for me. I'm doing my sort of spiritual work in the morning every day, and journaling and this, that, and the other. And, oh yeah, I should be good, right? So I'm 100%. But we don't have a little light bulb that, or a meter that says, oh yes, you're operating at 100% of optimal. We don't know that. And so the idea of screening for me is, okay, let me check and make sure that what I'm doing is actually working.
Mm-hmm.
Because if you screen, and let's say, so tomorrow, yay for me, I'm having my colonoscopy. Let's just say that they find a polyp. I've not had polyps in the past. Let's say they find a polyp tomorrow. Well, then for me, I'm taking that to heart and saying, oh, I'm not doing as good a job as I need to with my diet and other behavior. I need to clean up my act some more.
Mm-hmm.
So I look at it as a way to tell me early on that I'm deviating from this ideal path that I thought I was on, and now it gives me an opportunity to intervene before you have some, Goomba growing in there.
Right.
And so now it's like, okay, now I can take that responsibility and improve my habits.
Right.
And say, well, my diet was pretty good, but I have room for improvement. Okay, I'm going to eat more vegetables and raw vegetables and more fruit, and not as much, say, dried fruit, whatever. I'm going to drink more water. I mean, whatever it is, right? And so I look at screening as not something to be fearful of, but something to want to do to see where you are so that you can adjust. It's sort of like driving without headlights. Driving along and you're on the
Good
road,
analogy.
you know, and you think everything's going right, you know, and then you turn on your headlights and you're like heading towards a cliff.
Right.
Well, you know, to me, the screening test tells you, hey, you need to change direction. So that's how I think about it. But I think you're right. I mean, I have friends that do not go to the doctor at all. I have one friend that I did her last physical, and that was in sometime before 1996, because it was in my first office. And I moved in 96, and she's probably 65, and she has not seen a doctor since then.
Wow.
And it's like, holy moly. And I definitely agree that your belief that you don't, you know, like I have family history of breast cancer, but I don't believe that I'm going to get breast cancer because I'm doing things and I'm working on myself and, you know, to thwart actually having anything. But I get my mammograms, and every 3 years I get an MRI and I check, and that would be the idea in this instance, is to catch something early,
right,
where you can intervene, you know, without, you know, having to have massive surgery or chemo or radiation or whatever, you know. You catch things early when you have the opportunity to change what you're doing. It's your feedback that's telling you, oh, mammogram's clear. Okay, you're doing all right. Next year, oh, mammogram's showing something. Oh, maybe I need to do something different.
Right.
So it gives you the opportunity to take, to be a bit more in control, in the sense of what you do that has such an impact on your health. In our previous session that we recorded this morning, we talked about, you know, that personal responsibility we always get back to.
We always do.
Always, because that's what it comes down to. And we talked about the habits that are foundational for good health. Well, sleep, you know, I've had people tell me, oh, I'll sleep when I'm dead. I'm like, well, you're going to be dead a whole lot sooner. You know, hydration, nutrition, activity, exercise, and some kind of spiritual foundation and emotional health. You know, you take care of those, they impact your genetic expression.
Right.
So they have genes for something, like cancer. Let's just say you have a cancer gene, but that gene has to be turned on, and it's turned on based on your behavior. So if you supersize it and smoke and are stressed all the time and get 4 hours of sleep at night, well, you know, that's the recipe, you know, for turning that gene on.
Right.
And so when you do your screening tests, you can kind of get a little feedback of, oh, okay, I'm on the right track. So if I've got a bunch of polyps tomorrow, then it's like, okay, Frenesa, you need to get real, and you need to really clean up your diet. It gives me the opportunity to intervene.
Well, and the opportunity without going into fear, right? Because, you know, you've got a polyp doesn't mean that you need to jump into fear. If you find, you know, if there's a little mass that they find in the mammogram, so much more often than not, it's a cyst, you know, it's hormonally changed. I mean, however, you need to get it checked out without going into fear, because fear is just going to heighten the whole essence that there's something wrong. When you go into fear and you assume that something's wrong and something's going to be traumatic, then what you're doing is just shutting your own cells down. You know, our cells operate in that growth, or they contract. And when we go into fear, they shrink down and the cell membrane wall becomes a lot weaker. You have a lot more opportunity for something to take place.
Yeah.
Where if you're keeping yourself healthy and you're thinking straight, then you've got a much more, there was a woman years ago. Wow, this is probably 20 years ago, that she had called, and she had breast cancer that had metastasized throughout her whole chest wall. And the thing is, when she was in her early 20s, they found a small lump. And she decided she did not want to have the lump taken out, that she would work on diet and exercise and so forth. Very much a young hippie, and just, changed her lifestyle. And when I talked to her, she was in her 80s. And now they had found that it had eaten away at her chest wall. And I remember her saying to me, I should have had that lump removed. And I just said to her, I mean, that was in your 20s, you're now in your 80s. Did you have a good life, healthy life? And she's like, absolutely, had a wonderful life, had my kids and had a wonderful life. And I'm like, so you're in your 80s. I mean, we're all going to go at some point. Not going into the fear mode of having the lump removed and possibly any other stuff done at that point. Have you had a good life? And she's like, yeah. And I'm like, so did you really make a wrong decision? You made the decision that was right for you, and you never gave it another thought. Didn't bug you. You didn't keep going back and checking it. You were just like, I'm going to work on this my way. So now you've had a very effective, fruitful life. You didn't make a wrong choice. You simply made a choice.
Right.
It's your decision as to whether or not it's a wrong choice. Some people get into doing the pre-screening. And one of the things that I always do is when I have my mammograms, and I have them every year, is you're going to find thicker skin on the outer side of my right breast. And that's because had a client that just tried to rip that breast off during a psychotic episode. So I go in fully knowledgeable, tell my radiologist who's doing the testing that this is what they're going to find, so that I don't get that phone call a couple of days later going, oh, we found some abnormalities. Well, no, you didn't. It's been there for 20 years. So, we're good. Any place else, let me know. And it takes away the fear factor of, oh my gosh, are they going to find something? Because I know they are going to find an abnormality.
Right.
Just from the tearing. So, but I hear a lot back from folks about, what about the radiation? You're getting the radiation from the mammogram, you're having dyes put in when you're having an abdominal scan, yada, 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 yada. And I always go back to, technology has become phenomenal. There's a reason why we have Western medicine and technology.
Yeah.
Beautiful people.
Serves its purpose.
It serves its purpose. But the radiation that we receive from a mammogram, in my mind, is so offset by the knowledge that my body is in good health. Talk to me about that.
Yeah, well, the amount of radiation that is delivered has come down over the years. So that, has really gotten much less. We're exposed to radiation just walking out in the street in the sunlight. And we know that, when you have a healthy diet and you have all of those nutrients, and you're not stressed and having, stress hormones floating around, and, you're exercising and you're doing all those healthy things, you can withstand a lot of things. You can actually take poison in tiny amounts over time and not die. You can take small amounts of venom from a snake, right? And you can acclimate to it. So
yeah.
I'm just saying that as an extreme example of, just because something's poison doesn't mean that the amount that you're getting is going to kill you.
Right.
You know,
Right.
so,
Right.
and think of it in the big context. It's giving you information that you are able to take and use and do something to help yourself. And so um, while in the past, I do believe that the amount of radiation may have contributed to some cancers. In today's world, I really do not believe that to be the case.
Yeah.
And I think it's always everything we do is a choice, and it's always, you have to assess your personal situation. And so, if you have those kinds of concerns, then maybe you go every other year.
Right.
But you go in and you get a breast exam, from
And
a
something
medical
we can be doing monthly ourselves, right?
Exactly. So yes, I understand those concerns, but I think that that risk reward you have to assess for yourself.
Mhm.
I think things like pap smears, which they're, no one wants to get up in stirrups and, I me,
Right.
me
Right.
but on the other hand, I have seen what happens when people go into fear and don't do anything. So I actually had a client rather, years ago when I had a practice, that had an abnormal pap smear 5 years prior and was so scared, never went back. So by the time I saw her, her cervix literally looked like a walnut and it was
Wow.
hard as a rock. And she wound up having to get 2/3 of her vagina removed, hysterectomy, lymph node dissection, radiation. And I thought, oh my God, that was all fear.
Yeah.
And what she had was an abnormal pap smear and probably just needed a colposcopy or LEEP procedure, some, localized procedure.
Right.
This turned
Right.
into this massive surgery.
Yeah. Yeah.
And so, like you said, get your pap smear, don't go into fear, go into, oh, okay, great, you found it, it's early, let's
Exactly.
do something about it,
Yeah.
because guess what, we have time to be able to do something about it.
Absolutely.
So, I think we need to change our mind about what, the screening test is. And even if something's found, now you have an opportunity to do something. But
Right.
like in this scenario with this young woman, an abnormal pap, 5 years of not doing anything, but being fearful the whole time.
The whole time. Yeah. Just
And then she had
to
this
build and build and build it. Yeah.
so she had this horrible outcome, and so, we should look at screening tests as, yes, it's going to give me feedback that I can then use to gauge how I'm doing. So for my colonoscopy, if I find polyps tomorrow, well, then I'm doubling down on improving my diet.
No more pound
fear.
cake.
And I'm not going to say no more pound cake. I don't eat pound cake as much, but really more fiber
Sure.
foods, hydration and blah, 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 blah. So, we have to look at it in the positive
Yeah.
as, okay, I'm going to do these things so that I can know and get that feedback
Right.
that tells me what I should do next. Or if I'm on the road, then it's all good.
Right. But there's a mentality that goes on, and I've seen it over and over again within my own family and clients and so forth. You go in, you have a colonoscopy, they take out the polyps. Well, they got the polyps taken out of, they took the polyps out and everything was good. So they don't change.
Right.
Because in their mind, the polyps have been removed. So why do they have to change anything? And
because
it's like,
the
very fact that they found the polyps to
Right.
begin with, that you had polyps growing, is concerning enough. I mean,
Right.
I'm the older of us, but I still have never had a polyp found.
Right. But the thing is, the polyp is the message.
Is the message. That's
It's
right.
telling you, hey, you need to clean up your act.
Yep. Yep. So
And you're so
true.
right.
Yeah.
Most people go, oh, it's gone. Let me go back and keep supersizing it and eating, whatever and, whatever habits. Or I'm eating a decent diet, but ooh, it's not good enough. I
Right.
need to, I need to tighten it up.
Right.
And
Right.
and I've told patients before, if you listen to your body, it'll tell you what's wrong.
Hmm.
And from that, you'll know what you need to do next. So that's how we need to take this. We take this as a message.
Right.
And it's your body imploring you to make the changes,
Yeah.
you know.
Absolutely.
And so, no fear, embrace it and do it.
And do it. And do it. And not be so scared about, realizing that we can read about anything, right? We can read something that's going to uphold and reaffirm our personal responsibility and our spiritual growth. And we can read things that are going to scare the heck out of us.
Right.
Which one are you going to choose? I would probably choose both. If I were looking at a disease, I would probably a cancer. I would probably read both because I want somewhere in the balance. I want somewhere in the middle. I don't need to be scared out of my mind, but spiritual may not just be enough. And so I want to be able to bring in both pieces and make an informed decision according to my body and how my body feels as I'm reading it.
Right.
And I think that people, we give our power away so much to medical professionals, to specialists, and so forth. And it's not that you don't want your doctor's input, but you and I have talked about this for years. If you want to follow a holistic path and your doctor doesn't believe in that, switch doctors. There are many doctors such as yourself.
Right. There are actually functional medicine oncologists.
Exactly.
So you're absolutely right. And the thing too is, if you don't have faith and trust and you're not in alignment with your doctor, then you're having conflict all the time.
Yeah.
And that conflict has a negative effect on your body.
Right.
And so, it's really important to choose your doctor wisely. Let me just say this last thing, because I know we're running out of time. It's your responsibility to find a healthcare practitioner that works with you.
Right.
You don't go to the doctor and just say, okay, you tell me what to do. And like you said, give your power away.
Right. Right.
It's a two-way street. So I've had patients come to me and say, okay, doc, what do I do? And I'm like, well, this is what I think you have. And these are the different things that can be done.
Yeah. Yeah.
How do you want to do this?
Right.
Because
exactly.
the key is, I can tell you that I want you to do A, but if you don't really want to do A, you're not going to do it.
You're not going to do it. That's so true. That's
so let's be honest. Let's look at the options. Let's look at the one that resonates for you, and let's start there.
Yeah.
And then we're all on the same train.
Well,
in the same direction.
And finding that doctor that's a good fit for you. My current doctor, since you live far away now, but he understands my body. He understands the quirkiness of it. And, having issues with my stomach, he said, I want you to go see the surgeon. I think he would be a good match for you. I want you to go see him. I went to see the surgeon, and the surgeon and I talked about what was going on and so forth with my body and what was taking place. And the first thing he did was, I want you to do this for the next year. And, unless you have serious problems. And he cleared out a space and he got on the floor in his examining room and he showed me 3 yoga poses that he wanted me to do to stretch my abdominal wall, to open space up to see if my digestion would get better. He wasn't jumping in there of let's do surgery. He was saying, let's do some yoga first and do some yoga stretches. And I thought that was amazing. I thought that was amazing because you're going to a surgeon, you're expecting him to, or him or her to say, let's do this.
Cut it out.
Wasn't at all. Let's look at stretching that out. So, you know, folks, choose your doctor wisely. Do your pre-screening, and when you do get a diagnosis of something, don't go into a panic. Don't go into fear.
Action.
Yes.
Take action.
Take action. Yeah. So thank you so much for joining me today on part 1, diagnosis cancer, what now? And stay tuned for part 2, and we'll be back in a little bit. Thank you so much, folks.